Meru County.
There are a few rumors which have been going around, and especially in the media. You know, we were surprised to hear somebody talking about a renal unit in Meru is not working. I would want to thank Our Excellency the Governor for bringing this unit to work. In fact, as we have been told by the doctors here, there is nothing that is missing in this unit. And for the last 1 week or so, they have done more than 137 sessions. So whoever comes here is going to be dialyzed. And there is nobody who has been sent away because of lack of the consumables, because of lack of the nurses, because of the lack of the doctors. So we are saying those rumors are unfounded. So we should not bring politics when it comes to health. Let us go for the actual things.
There is no moment that we have interrupted our services. In this institution, we've offered our services Sunday to Sunday and every day of the week and in 24 hours. So we have 10 bed capacity, we have 10 dialysis machines, and we are able to dialyze patients in 24 hours. We run 3 sessions per day. We have 7 qualified dialysis nurses who are specifically and specialized training in dialysis. So our patients are able to get specialty care. We have got a total of 42 patients who are seeking services in this unit, and all our patients are covered under NHIF, of which is a plus to the institution, and the patient is also able to be relieved of the burden of being to pay for cash, because we know each session is catered for at 9,500 shillings. At the moment, we have all machines are functional, and there is no patient that we are turning away to seek for dialysis services in any other institution. And in case a patient comes in at any time, even if it's at the night, we have our nurses who are here waiting, and we are able to dialyze the patient. We also have the dialysis catheters, and our team of medical officers are able to fit the patient the catheter at the time that they come in. We have adequate supplies for take care for the dialysis patient, and for the ICU patients are able to be dialyzed in ICU because we have a port for dialyzing our patient.
Tunashukuru watu wa Meru kwa kuendelea kutuunga mkono, kuendelea kuwapa haya matibabu. Tungependa kuwahimiza kuwa mchukue kadi za NHIF. Mnaona hawa watu wote wanaotibiwa kwa hii department wako na kadi hizi za NHIF, na hawalipi chochote kuongezea, inaweza kusimamia matibabu yote. Kwa hivyo watu wote waweze kuchukua kadi hizi za NHIF ndio waweze kusaidiwa kwa kulipa bill zao za hospitali. Tunashukuru pia county kwa kuendelea kutuunga mkono, kupeana services hii kwa watu wote wa Meru, na tunaomba kuwa tutaendelea kusaidiana na wao, wataendelea kutusaidia especially kwa kutuongezea wauguzi ndio tuweze kuendelea grow facility hii yetu ya Meru, kuendelea kuwasaidia.
Tuna isolation machine hapa nyuma. It's able to dialyze hepatitis B patients. We offer services to those patients who are hepatitis B positive. Meru County, we are lucky. Tuko na amongst the 3 counties, Isiolo and Tharaka Nithi, Meru County ni sisi peke yetu tuko na the isolation machine, so we take care of the patients from Tharaka Nithi, Isiolo and Meru. Patients wakikuja during dialysis, tunawapea nutritional advice. Wako na nutritionist who comes to review them. We also have our physician who comes to review the patients during dialysis.
Let's encourage the people in Meru and the surrounding counties to utilize the services we are giving, rather than spending money going far away into Nairobi and other places. Very soon, and I believe this will happen in our time, we will venture into kidney transplants so that we can offload some of this burden from the national hospitals and we are looking forward to collaborating with partners and even the residents of Meru. Support your hospital.
Ukanoga ni gwita gucwa utungata kuraja nagwe kairi Meru County tukureterete utungata akuwe nagwe Meru County wendo bote kwathurana.